everybody. This is Jess from 3D Learning Experts, and you're listening to the LD Experts Podcast, the show for busy parents who want to help their kids with learning disabilities, or as I like to say, learning differences, go from surviving to thriving. Hello, everybody. Today we have the fortunate opportunity to meet with Karen Wilson, who is the CEO and founder of ChildNEXUS, and she is a neuropsychologist, and she will be sharing with us about neuropsychological testing and why it is important for children to be tested. And so welcome, Karen.
Thank you so much for having me. I'm glad to be here.
Yes, I'm so excited to hear more about testing, and great to have you here with us from Toronto. Karen splits her time between Toronto and Los Angeles. So
I do.
all right. So tell us a little bit about your business and what you offer families, and then let's talk about testing.
Absolutely. So I am a pediatric neuropsychologist by trade, and I spend my time evaluating kids who struggle with learning or social emotional challenges, processing issues that impact learning. I've been doing that for, almost 2 decades now. And then probably right around COVID, I realized that I wanted to support more families because so many parents didn't have access to just the information they needed to be able to recognize when their kids are struggling and how to reach out for support. And I just felt, after meeting with hundreds of families who actually made it into my office, that parents were asking for information. They're asking for support. They're asking for connections, and they're asking for advice on how do I advocate for my child at school. So that's when ChildNEXUS was born. And, it's a digital platform that presents parents with information related to learning, processing, or social emotional challenges that kids face, and provides opportunities for them to book a consultation or connect with providers who specialize in different aspects of supporting students, whether that's occupational therapy, speech and language therapy, child psychology, or educational therapy. So a lot of different interventions that kids might need.
That's awesome. So you can direct people on what is best for them.
Right.
Wonderful. So how do you help families? Do they just go on the site, or do you still do assessments?
We do both. And so those are 2 separate businesses. So I have a private practice. We have 4 clinicians in my practice, and we do evaluations. And then, sometimes parents are just looking for information and wanting to know if their suspicions are accurate, whether it warrants, reaching out to a teacher or reaching back to their pediatrician. And we want to give them the information they need to make better informed decisions when seeking out services for their kids. So they can go to the site just to get information, read articles, download our podcasts, or they can, again, connect with individuals who do assessments, do interventions, or even advocates who can work with them to help them get what they need for their children at school.
Wonderful. And our theme for this month has been very much talking to different advocates about IEPs. So if they can also look on your platform to find other advocates.
Absolutely.
The ones that we've interviewed this month.
Yes.
Awesome. So when you do the neuropsych evals, what does that entail, and what can parents hope to find out from them?
Yeah, well, typically when parents come to me or one of my colleagues for a neuropsychological assessment, it's because they have noticed something in their child. Their child has been struggling in some way. The teachers have noticed it. Maybe a pediatrician has seen it in the office and has listened to parents talk about the struggles, and they really don't know what the struggle is. So they want to find out, is this a social emotional issue? Is this, an environmental issue? Is the school just not right for my child? Or is this something neurobiological going on, in my child's brain, or is my child's brain wired differently, which makes school or aspects of interacting with their environment or their peers difficult for them? And so they're coming for answers. So when you're seeking out a neuropsychological assessments, because you want answers, you want to know why your child is struggling. And that's what we do in that assessment, is we answer that question through a series of processes that, we can go into in terms of what that looks like.
And does it differ for each individual, the tests that you do, or is it just one standard test?
Yeah, it really differs depending on why parents are coming in. And that's why we never start the assessment process with the testing itself. It actually starts with an interview with parents. We want to know what it is parents are seeing at home. We want to know what teachers are seeing at school. And we want to get a really good history, the child's history. I always say it's everything from, pregnancy, birth and delivery to where your child is now, and getting a good family history, because we know that a lot of learning challenges, social emotional challenges, psychiatric issues run in families. And what that tells us is what your child is at greater risk for, based on genetics. And then we want to get a really good idea of things that you've observed, parents have observed as their child was growing up, during pregnancy. Again, was there anything out of the ordinary during pregnancy? And an early delivery of a very small preemie puts kids at greater risk, those kids at greater risk for learning challenges later on. And so that tells us a little bit. We want to know, is there an early history of language delays or late walking? All of those things give us an indication of whether or not some of the struggles, some of the delays are global or they're very specific. And that would mean that we also need a very specific type of intervention if that's the case.
And what if a child has been adopted and the parent doesn't know all of the beginning history of this individual?
Right. We do the best we can regarding history. If we don't have it, I've, assessed a number of kids who are in that situation where they have been adopted and parents don't have a good family history. So we just rely on what those parents have observed since, they adopted that child. If it's, adopted at infancy or adopted later on, then we look at, where were they in terms of their developmental milestones from the time that they were adopted moving forward.
And how does your evaluation differ from the school psychologist's evaluation?
We get that a lot. It differs in a number of different ways. One is that the question that you're asking is very different. When you're going for a school evaluation, a school-based evaluation, oftentimes as part of an IEP, the question is, does your child qualify or meet the criteria for special education services through the school? That's all they want to know, right? They're not making a diagnosis, although your child might get categorized as having, for example, a specific learning disorder or other health impairment, but they're not going to diagnose your child with ADHD or with dyslexia. So their whole goal is, does your child need special education services, full stop? And if they do, and then the next step is, what will those services look like, right? And so that's kind of the whole scope of a school assessment. And when you're looking at, a neuropsychological assessment, my question is, why is your child struggling, right? Why is your child struggling at school? Why is your child struggling at home, like I said before? And during that process, I may get a diagnosis for your child, but that's not the purpose of doing the evaluation, is to get a diagnosis. It's really to understand why your child is struggling. For example, if a child is struggling with reading comprehension in the second grade, what I want to know as a neuropsychologist is your child struggling because of difficulties with phonological processing that is tied to dyslexia? Is your child struggling with reading comprehension because of a language disorder tied to kind of an understanding of language, vocabulary, syntax? Is your child struggling with reading comprehension because of an attention issue? Is that they can read accurately, they can read quickly, but they're not paying attention to all the words on the page, and therefore it's negatively impacting reading comprehension, right? Are they struggling with reading comprehension because of a working memory issue, where again, they have a hard time holding all of the details of what they're reading while they're reading the text, and then when they're asked questions about it, they just don't remember, or they've forgotten. And so those are the kinds of questions I want to ask, because if a child is struggling with reading comprehension for a phonological processing, because of a phonological processing issue, or an attention issue, or a language issue, those are 3 different types of interventions that are going to be needed by that child. And so identifying the reason for the struggle is the most important thing that we look at in terms of a neuropsych assessment. Of course, we're going to give you a treatment plan, we're going to make recommendations, but we want to know why first, because there's no point in intervening if you don't know why the struggle is there to begin with.
Absolutely. I've heard so many families have taken their kids to vision therapy, expecting their child to come out of it learning how to read. And those are 2 very different challenges.
Absolutely.
Dyslexia and vision.
Absolutely. Absolutely.
So what if it is a vision issue? Would you be able to identify that it's not any of those other 3 categories and recommend they go to a vision therapist to assess that, or can you assess that as well?
Yeah, we don't assess for vision issues, but if we're noticing that they're having trouble scanning or they're squinting, then we will refer them out. We'll probably refer them out before we even complete the assessment, because we don't want those issues to interfere with the assessment process and the interpretation of those results.
Oh, that's excellent.
Yes.
And so, it sounds like I didn't realize how different an outside evaluation is from a school evaluation. What happens, because a lot of times I've heard that schools don't accept outside evaluations. Mm-hmm. Do you run into that? And what recommendations do you have for families?
Yeah, I'd always say consult with an advocate. We talked about that before we got on today. But the majority of schools that I've worked with have taken the evaluation. It doesn't mean that they're going to implement all the recommendations in that report, but they will consider the results and consider the impressions that were formed. Schools have to do their own testing, and they will. But they do, I think, legally have to at least consider additional data if it's presented to them. And an advocate or an educational attorney would probably would be better able to answer that question specifically. But again, the scope of an assessment will differ as well. It's not only the reason why or the questions you're asking when you're doing an assessment. Oftentimes, for example, a neuropsychological assessment is much more comprehensive than a school-based assessment, because we want to make sure that we, again, fully understand what is happening with this child. And so we won't just look at reading if they suspect there's a reading, because what if it's not reading? What if it's anxiety? So we have to look at social emotional issues, because we know that social emotional factors can mimic learning difficulties, and they can also exacerbate and make those difficulties worse. If you think about a kid with dyscalculia who also has math anxiety, right? Those 2 things can coexist. And so they would both need to be addressed, not just one.
Absolutely. Yeah. That's a great point, that schools won't pick up on those details. And so when a parent comes to you and that child's already had the school evaluation, it's still going to give them a much clearer picture of what's going on than the school evaluation, which would just determine if they qualify for an IEP. Is that correct?
Yeah, absolutely. And then also something to keep in mind is when kids have learning struggles, if they've been identified as having a specific learning disorder, they have dyslexia, for example, kids with dyslexia are an increased risk for having another processing or learning challenge. So I think the research is like 40 to 50% of kids with dyslexia also have ADHD. And the same is true for kids with ADHD. 40 to 50% also have a learning disorder. So if you have a school that identifies a specific learning disorder in reading, which we will call dyslexia, they may be missing 40 to 50% of the time. They're also missing a coexisting attention issue, which also needs to be addressed. And so when I'm doing an evaluation, I'm going to always evaluate for both of those things because I know that they frequently co-occur and they both need to be addressed. If you think about a child who has been identified as having dyslexia, needs an intense intervention. In order to participate in that intervention, rather, they have to have good attention. There's no sense in having a child work, one-on-one or in a small group for an extended period of time, and they're not fully paying attention because of a missed ADHD. So you have to be able to identify both and address both in order for a child to really benefit from that intervention. Does that make sense?
Oh, absolutely. And so what is your recommendation when they are identified with ADHD as well as dyslexia?
Yeah, both of them have to be addressed and treated. And of course, treatment for ADHD can vary depending on the age of the child and the severity of the symptoms. We know that medication management is effective, I think, in 75 to 90% of individuals with ADHD, but there was a reluctance from parents to start particularly very young children with medication, which I fully understand. So there are behavioral strategies, there are accommodations, there are things that you can do and put in place to support kids who have attention issues, but you want to make sure that those supports are in place while they're working on developing those lagging skills in the area of reading and particularly phonological processing.
Yeah, that's fantastic advice, because we actually have a student right now who her and her mother have some attention challenges. And so my tutor says it's like herding cats, trying to get the mom and the student to, come back to focus.
Right. Absolutely.
So, are you also able to prescribe medicine, or would you refer to a doctor or pediatrician at that point?
Yeah, I would typically refer out for medication for either anxiety, depression, ADHD to a pediatric psychiatrist or a developmental pediatrician who specializes in those issues and presentations in children. So I'm a psychologist, clinical psychologist with specialization in neuropsychology, and so I don't prescribe medication.
Got it. And how long does the process usually take for the screening?
So for a screening, it can be very brief. Not all kids need a full neuropsychological assessment right off the bat. Sometimes parents will kind of do a piecemeal approach because they want to, they may have, for example, a family history of dyslexia and ADHD, and they've got a child who's, entering first grade and really has struggled with learning the alphabet, rhyming, and they just want to do a dyslexia screen. That is sufficient to be able to identify kids who have dyslexia or are at great risk for dyslexia and identify whether they need an intervention at that point. And then some parents, for example, have tried a number of different things and they just don't have any answers. Maybe they've tried tutoring because their child was behind, or the teacher met with the child before class and did some extra work, but they still don't have an idea or an understanding of, again, why their child is struggling. And so for those families, they want something more comprehensive because they really want to have an idea of their child's learning profile, which is what a neuropsychological assessment will tell you. It'll give you a profile of your child's not only areas of weakness, but identify your child's strengths. And I often say that that's equally important and probably even more important for kids who are struggling to be able to identify those areas of strength, because those are the areas that children use to compensate for areas of struggle. And so if you know what they are, then when you're developing an intervention and strategies for helping that child, you can really lean into their strengths in order to support them.
So, timing, from beginning to end, is it a matter of weeks, a matter of months?
Yeah, it depends on when we get things in. It's usually I'd say about 20 hours, is what I tell families. When you think about from beginning to end, from interviewing the parents to assessing the child, to speaking with teachers and parents, and then having that feedback meeting, and then analyzing all the results and writing the report. So all of that can typically be done. The assessment process can typically be done in 1 week, right? Unless a child was really struggling with attention, we have to break up that assessment into really small chunks, and that can take a little bit longer. And then also, because part of the assessment is interviewing teachers and having them complete rating forms and having parents complete rating forms, sometimes that delays the process. Where, like, for example, we're going on spring break and I'm waiting on rating forms from teachers, but they're not at school right now. And so that will kind of draw out the process a little longer, because that is part of the assessment process. It's not just the testing that the child does in the office. We want to know, what are teachers seeing in the classroom? What are parents seeing at home? All of that information is part of the assessment process. And so until we have all of that data, then once we have all of that data, then we can start analyzing patterns, identifying, forming our impressions in terms of what's going on. And then we meet with parents to go over the results. So typically, the process can be anywhere from 2 weeks to 4 weeks, depending on, how quickly we can get information from parents and teachers.
Well, it sounds like it's a very in-depth process. And so, what can you help students who are outside of California with this, or is it state regulated or anything like that?
Yeah, so neuropsychologists or clinical psychologists, and those are regulated by states. So, for example, myself, I practice in California, right? I also practice in Ontario, Canada, rather. And so you want to connect with a clinical psychologist and clinical neuropsychologist in your state who can do the evaluation for your child.
Okay. And does health insurance cover these evaluations usually?
Yeah, it depends on the health insurance. Different companies have different levels of coverage and that can differ from company to company. I always say, check with your health insurance provider to see whether they cover it and under what circumstances do they cover it. Sometimes they'll say, we need a referral from your pediatrician, or there needs to be a documented early history of delays, whatever that might be, to check in with them, check in with your pediatrician, who might be able to facilitate getting it covered through your insurance. And
have you found that this is becoming more common, that insurance companies are covering it than, say, 10 years ago?
I would say, in terms of what I've seen in my practice, I can only speak to that. Yes, absolutely. I'm seeing that. And then the other thing that parents should know is that, legally, if they don't agree with the school assessment, and again, I want to defer to an attorney on the process for that. But for example, if a school has done their own assessment and the school has said, we think your child is fine, and you don't agree, you can ask the school for an IEE, an independent educational evaluation. And those assessments can often be done by clinical psychologists or clinical neuropsychologists. I've done a number of those for school districts in California. And so that's another option for parents, where they can get a neuropsychological assessment or a very comprehensive psychoeducational assessment that is paid for by the school district.
Oh, that's great news, because
yes,
what I've heard is the average cost is about $2,500 to $3,500 in California. Is that about correct?
It's probably higher than that.
Oh, okay.
Yeah. It depends on the scope of it, but it can definitely differ depending on where in California it's being done and who's doing the assessment.
Okay. That's good to know. Yeah, that's great information, that you can potentially get the school to pay for it if they disqualify your child. I wish I was doing this podcast when I was still raising my children, so I could have gotten them more services and help that I now am aware of, that I wasn't aware of when they were kids.
Yeah, so many parents say that, they say, I wasn't aware, which is part of the reason why I think it's just so important to empower parents with information that they can use. Even if your child does get some services, maybe you think it's not enough. Maybe you think that they missed something. You can still request an IEE under those circumstances. So again, always check in with an advocate regarding what your rights are as a parent, because oftentimes parents just don't know what their rights are. And I think that's a really great first step.
Yeah, absolutely. Well, this has been so informative. Thank you so much, Karen, for taking the time out of your busy day to come and meet with us and share information. Do you have any final notes you want to share with parents, that recommendations?
Yeah, I would say that.
Sorry, let me redo that. Do you have any final recommendations for parents?
Yeah, I think one of the things I'll say is that parents often say that I always had a gut feeling that something was awry or something was not right. And, they will be told by teachers or by other family members that your child is fine, don't worry about it, or they'll grow out of it, or he's just a boy, or she's just shy. I always tell parents, lean into your gut and trust your gut and seek an evaluation either, through your pediatrician or through the school to answer that question, because oftentimes the gut is correct. I don't think I've ever had a parent who said, I always thought something was wrong and everything was fine.
That is amazing advice, because it's so true that schools often are telling parents, oh, just give it time. And they give it 3 years and then they're 3 years farther behind.
Absolutely.
So for our podcast listeners, will you share what is the best way to either get a hold of you or your colleagues, and also your website with service providers?
Yes. So the best way to kind of connect with the information, a lot of the information I provided is through ChildNEXUS.com. On that site, you can search for articles related to dyslexia, dysgraphia, ADHD, how to get a special education assessment for your child, all through the website. We have podcast episodes on similar topics. And you can reach out to me at drkiwilson@childnexus.com. I check my email and I'll respond to you personally. There's also a contact form in the website.
Perfect. Thank you so much, Karen. I really appreciate you.
Thank you so much for having me.